compared to urban settings, rural Americans have higher depression and suicide rates and are, of course, less likely to have access to mental health care services. Think about our small towns. You have 95% of counties in rural America that don't have access to a child psychologist. I think it's roughly 85% of the counties don't have access to an adult psychologist. Farmers and ranchers are nearly twice as likely to die by suicide in the U.S. as compared to other occupations. And in talking about that, the rates in rural areas have risen about 65%. Suicide rates are about 65% higher in rural areas versus large urban areas. And just in the 20 years of 2000 to 2020, suicide rates increased 46% in our rural areas. So when you hear those statistics, a little sobering, isn't it?
It really is. So, what are some obviously it's easy to just say, oh, well, get some help or try and get some help, but what are some options out there for them to obtain that?
So here's a few things to think about. First of all, mental health looks different for everybody. For some people, it's depression. For others, it's anxiety. Not everything will end in suicide, but many struggle all on their own. Within the industry, one of the areas that has the highest propensity for suicides, veterinarians. If that doesn't surprise you. Yeah, veterinarians are one of those areas. Unfortunately, we see more stress in our kids. So you're seeing students when they are doing farm safety days. It's not just about tractor driving and PTOs or handling livestock. Now they're talking about mental health. The conversation has always had a lot of stigmatisms around it. People didn't want to talk about how they were doing mentally, but that is changing. I hear more and more farmers who are willing to broach the subject and want to bring it up. I had a counselor or a woman who's working on her degree tell me just a few weeks ago in Minnesota that she would really like to open a practice, but her fear is in a small town that everybody knows your vehicle and that she wouldn't really have anybody who would let her be of help because they are afraid that someone would see them. So I hope that we are able to start moving past that because our rates are very high. We don't want to lose any more folks to what's been happening. And we're at the high point of some anxiety and stress already with our farm community.